Hello, my name is Erica Marie Vargas, and I'm a third year graduating nursing student here at UTS. Ultimately, my goal as a nurse is to become a pediatric nurse working in a NICU unit in one of the big children's hospitals here in Sydney. But as I'm still a third year student, I'm currently still transitioning into the workforce. So I prepared 4 different learning goals and 4 different subheadings, categories, for me to ultimately achieve into going to become a pediatric nurse. So my first goal is a nurse as a graduate. So as a future new graduate nurse, there are many aspects of clinical practice that I'm still not confident in. Therefore, in this section, my goal is to gain confidence in my clinical skills and practice in order to give holistic patient care. And in order for me to do that, I've prepared certain action plans and strategies for me to meet. These include attending in-services in order to increase my clinical knowledge, learn as much clinical skills as I'm able from senior nurses in the ward, practice clinical skills until I am confident in executing them, take every situation as a learning opportunity, and keep my mind open and never hesitate to ask questions. The next subcategory is a nurse as a leader. Throughout all the healthcare systems, nurses have been called in differing situations to perform as a leader. So therefore, my goal in this section is to provide leadership to nursing students and to guide them into becoming good future nurses. This goal can be challenging as I'm not a very outspoken person, and therefore I might find it a bit difficult to lead and guide my own set of nursing students. So my plan and strategies in this section for me to achieve is to attend as well available in-services so that I'm able to pass on my knowledge to nursing students, read articles on the importance of education and therefore the importance of leadership skills and executing them, work on and practice my communication skills, which can be done through increased interactions with nursing staff, patients, and families, and make sure my knowledge on clinical skills and practices are current and accurate. Next section, the nurse as an educator. Education is fundamental towards the clinical development of all nurses, as it provides opportunities for clinical learning and teaching. Therefore, my goal in this section is to study hard and someday achieve the title of a clinical nurse educator, or a CNE. In order to achieve this, the following goals should be met. Find and learn from a nurse with outstanding clinical knowledge and skills. Continue education through postgraduate nursing and undertake CNE courses in universities and apply theory and skills into practice. Last but not least, last category is a nurse as a manager. So in this section, critical thinking is often discussed by nursing leaders, and they have come to an agreement that the ability to think critically and logically in any given situation is integral to nursing practice. Therefore, my goal in this section is to be able to handle conflicts and think critically in any given circumstances. So, in order for me to achieve this goal, I should be able to practice and work on my clinical skills, attend in-services or seminars to increase my clinical knowledge in order to have effective clinical thinking. Always have time to think critically before providing patient care or undergoing procedures. Observe and reflect on any performances that may need to be practiced or improved. And coordinate effectively with the nursing staff in order to lessen the workload and therefore reduce stresses and job dissatisfaction. So hopefully I can achieve all of these 4 goals throughout my nursing career and then ultimately achieve my ultimate goal is becoming a pediatric nurse. Yeah, thank you.